My name is Laura Reed. I'm Administrative Director at Live Oak Surgery Center in Plano, Texas. Live Oak Surgery Center was built back in 2018, and then we didn't get really busy until around 2019. It's a multi-specialty surgery center that is owned by 51% by Children's Hospital, and the other is physician-owned. We primarily do a lot of sports medicine, orthopedic medicine. We do plastics, ENT, and GI. We're majority pediatrics, but we still do adults. We started out with HST. I've used other products in the past, but I've also used HST in the past. It's not the first time. We use Clarity, patient engagement, case coordination, practice management. In the past, I've used Advantix. It was okay. It's very similar, but it wasn't as intuitive and there wasn't as much information. The reports were not as good. We had a lot of challenges with calling patients, and so using HST's case coordination with the patient engagement and having them fill out the pre-assessment and receiving the text messages, the patient survey, all of that has really solved a lot of challenges with nursing on the preoperative and the postoperative end. Absolutely. HST has a wealth of information. As long as your data entry is accurate and inputted in, it's a wealth of information, any and everything you could ever want to know, whether it's the times the surgery, it took the doctor to do the surgery, is it the staff utilization, block utilization, cost versus revenue, infection control reports. I mean, it has a perfect ASCA benchmarking tool that just makes the data entry portion, if you're benchmarking with ASCA or any other facility, just a breeze. It's just a wealth of information. Absolutely would recommend it. Again, just the wealth of information, like anything that I need to do, whether I'm trying to, we have a shift differential if I'm going in to see which nurse worked late to make sure she gets the shift differential. If I'm going in to see if a doctor is scheduling according to his block time and taking the amount of time that he says he's going to take. That's been amazing as far as like the wealth of information that you can get from the surgery time log. It just has so much information, and it's super helpful with making sure your surgery center is running efficiently according to time. Again, I just think the reports are it's just so much information and it just makes my job as the risk manager and any kind of quality metrics, any kind of performance improvement that study I'm doing, it just has all the information there. It's just at your fingertips, and it's easy to find. Yes. So with the surgery time log, I use that for block utilization, and it has helped me give feedback to the physician's offices on how long it's taking them to do the procedure, wheels in, wheels out, and to make sure we're capitalizing on their block time and make sure we're scheduling appropriately. And then as far as with revenue growth, it has helped us document and follow how much reimbursement we're receiving, how much product we're using, which surgeons use more product, why do they use more product, why is their cost more substantial than maybe another doctor and they're doing the same procedure. It's just made that a lot easier and just opened the eyes. That was something that the governing board requested, and we've been following that for several months now, well over a year. Absolutely. I know that HST has a lot more to offer. I'm definitely interested in using the full portion of case coordination. I think that would help with efficiency and staffing, scheduling appropriately, communication, just a lot of things with the case coordination. Eventually, I'd like to use eChart. I think that would be great. I think while our center is relatively small, now would be a good time for implementation for something like that to take on. For the implementation, it was pretty straightforward. I believe everything was virtual, but they did set things up on their end, and it made it very easy for us. And then I've gotten a lot of really positive feedback from my nurses regarding how simple it has, how it simplified their job as far as preoperative phone calls. And then it's also for me, whenever I do my monthly patient questionnaires, it's made that like so much easier. But the implementation was very simple. I just had to assign people access, but they really love it. The nurses love it. Customer support is great. They may not always have the answer, but they do always immediately respond to you. They do try to help you, and if they can't get a hold of you, they'll call you. They've been absolutely wonderful. Just said it's a great product. I've used it for years and years. Like I said, somewhere else I used it, and I do prefer it over any of the alternatives. And it's just the wealth of information. Just as an administrator, any type of leader, gives you just all the tools you need, all the information that you want, all the data, all the statistics, everything that you're looking for, just at your fingertips. It's really a great product.